Hi everyone, I'm Maryam, and today I'll be walking you through the anatomy of the spine. We'll explore its structure, its critical functions in supporting our body and protecting the spinal cord, and finish by looking at common pathologies that can affect spinal health in both children and adults. Knowing the anatomy can help us decide what structures are at risk and what modalities we can monitor. By the end of this presentation, you'll see how intricate and important the spine really is, not just for posture and movement, but for our entire nervous system. The spine consists of 33 vertebrae divided into 5 distinct regions. There are the cervical, thoracic, lumbar, sacral, and coccygeal. It forms the central support for the body, allowing us to maintain posture, move freely, and protect our spinal cord. It's part of the axial skeleton, which includes our skull and our rib cage, and it serves as the body's structural core. As we move from the top of the spine to the bottom, vertebrae decrease in mobility, but they increase in strength. That basically means that the upper spine allows more movement, like turning our head, while the lower spine is built to carry more weight and stay stable. The spine is made up of bony segments called vertebrae and fibrous tissue called intervertebral discs. Both of these form a column from our head to pelvis, which help with symmetry and movement of our body. The spinal column is made up of 33 vertebral bones stacked on each other. 24 of these articulate with each other, while 9 of them are fused together. The cervical spine begins at the base of the skull, and it's made up of 7 vertebrae labeled C1 to C7. The first two, C1 called the atlas and C2 called the axis, play a large role in supporting the skull and allowing our head to turn. This region is the most mobile part of the spine, which is why we can nod and rotate our head so freely. However, this also makes it more vulnerable to injury, such as whiplash in car accidents. Because it connects the head to the rest of the body, injuries here can affect a lot of other bodily functions. The thoracic spine has 12 vertebrae, numbered T1 to T12. This area forms part of the rib cage, which protects important organs like the heart and the lungs. While it allows for some movement, its main role is protection and support. Below the thoracic spine is the lumbar spine, which includes 5 vertebrae, and it's numbered L1 to L5, and it's the largest and strongest segment. It bears the most weight and absorbs a lot of stress from movement. That's why many people experience lower back pain, especially from poor posture or lifting incorrectly. But together, these two regions balance mobility with strength. Moving downward, the sacrum is a bone made up of 5 fused vertebrae, and it connects the spine to the pelvis. The coccyx, or the tailbone, is made up of 3 to 5 fused vertebrae, and it might seem small, but it's actually really important. The coccyx serves as an anchor for key pelvic muscles and ligaments, including the ones that support the pelvic floor. It also helps us maintain balance when we sit, and it contributes to overall spinal alignment and posture. Inside the spinal column runs the spinal cord, which is part of the central nervous system. It acts like a two-way street, sending messages between the brain and the body. At each level, nerve roots branch out to control movement and sensation in different areas. So, for example, nerves from the cervical spine affect the arms and hands, while nerves from the lumbar spine control the legs. That's why a spinal injury at one level can cause specific symptoms depending on the area affected. When we look at the spine from the side, we can see 4 natural curves that form a gentle S shape as shown in the picture. These normal curves include cervical lordosis in the neck, thoracic kyphosis in the upper back, lumbar lordosis in the lower back, and sacral curve at the base. Together, they help balance the body, absorb shock, and support everyday movements like walking, bending, and lifting. But sometimes these curves can become exaggerated or shift in abnormal ways. Lordosis is when the lower back curves inward too much, which can lead to discomfort or lower back pain. Kyphosis is an excessive outward curve of the upper back, often seen in older adults or those with poor posture. And scoliosis is a sideways curve of the spine. and it usually develops during adolescence and requires careful monitoring or treatment depending on the severity. Understanding both the natural and abnormal spinal curves can help us recognize when something might be wrong, and it reminds us how important posture, movement, and spinal health really are. Spinal nerve injuries can vary widely in severity. Listed here are a few of the common types. We have a normal nerve, which is fully intact and can carry signals efficiently between the spinal cord and the body. In an avulsion, the most severe injury, the nerve root is actually pulled away from the spinal cord. This usually causes permanent damage. A rupture is also very serious, where the nerve is torn but not at the root, and that often requires surgery. In neuroma, the body tries to heal after an injury, but scar tissue forms, and this presses on the nerve and disrupts signals. Lastly, neuropraxia is the mildest form. It's a temporary block in nerve conduction, and it's often from pressure or stretching and usually recovers fully with time. Now, some more common spinal pathologies. Trauma includes fractures or dislocations that are caused by accidents or falls, and it can damage the spinal cord or nerves. We have congenital conditions, which occur when the spine doesn't form properly before birth and sometimes exposes the spinal cord. Tumors, which are either benign or cancerous, can grow in or near the spinal cord and compress nerves, which lead to pain or neurological symptoms. Spinal deformities are also common. In children, we often see scoliosis or kyphosis. In adults, age-related conditions like spinal stenosis or degenerative scoliosis can reduce mobility and cause chronic pain. Lastly, infections can cause inflammation, pain, and even neurological deficits if it's not treated quickly. These conditions highlight the importance of early detection, especially when symptoms like numbness or chronic pain are visible. To conclude, the spine isn't just a stack of bones. It's like the body's foundation. It holds us up and protects the nerves that let us feel, move, and live our daily lives. From turning our head to walking or even just sitting upright, our spine is working really hard behind the scenes. When we understand how it's built, we get a better sense of how to take care of it and what can go wrong. So, simple habits like standing tall, lifting things properly, staying active, and really just paying attention to pain that we feel can make a difference. That's all I have for you today. Thank you so much for listening, and I hope this PowerPoint presentation helped you see just how amazing and important our spine really is. Here are a few citations I used, and I thank you once again for listening.